Good morning and welcome to South-Dade Shoutout. My name is Richard Candia. I'm a realtor with Avanti Way Realty, but also privileged to serve as a board member of the South-Dade Chamber of Commerce. The South-Dade Shoutout is an opportunity to meet business and community leaders, learn more about the service and value that they give to our community, and further learn what makes their value proposition that much more special. Today, we are joined by Dr. Juan Cedeno. He's the leader of the new urology practice that is housed at the Homestead Hospital, part of the Baptist Health South Florida system. Welcome, Dr. Cedeno.
Thank you. Thank
It's
you
really
for
I'm,
having
I'm
me.
really really happy to meet you,
Likewise.
and welcome to South-Dade.
Thank
We're
you.
very excited to have you. Tell me a little bit about your background. We had a chance to meet a little bit beforehand. Where you studied, where you did your residency, and how did you get into urology?
So I'm like born and raised in Venezuela. That's where basically I did all my training in terms of the medical school and everything. I had the opportunity to be like the sons of two physicians. My parents both are physicians, and that's actually something that drive me a little bit into the medical field. However, when I was growing up, it was very kind of painful as a kid because they had to go to emergency, all that stuff.
Oh, okay.
So my brother and I used to joke about we are not gonna be doctors. So like when I was growing up, I was doing some sport and I got an injury, and there was a guy who did something in order to avoid the surgery, and seeing this act of like doing whatever it takes in order to help the patient who was ill, which in this case was me. Like basically, it was something I feel passionate about it and say this is what I want to do for a living. So
Wow.
then later on, I went to medical school. I was able to complete without any issues or anything like that. And I had to start doing a specialty. My specialty was to do something surgical since I was able to like use my hands pretty much. And then later on, I discovered urology. And the reason why I say discover urology is because like sometimes in medical school we have only 2 weeks of rotation in urology, and nobody knows. Everybody thinks just the kidney, the bladders, and prostate.
I was going to ask you about that.
And then yeah, I found like very very fascinating because all the technology that the specialty has.
So where did you do your residency after Venezuela?
So when I migrated to United States, I was able to do some research. I went to like Jackson Memorial Hospital where I did my internship there over there. It was a super nice, fascinating year where I learned a lot of stuff. And then I was able to get into the residency spot in Mount Sinai, Miami Beach, where
Mhm.
it's part of the Columbia University program. And then I did a fellowship in minimal invasive and reconstructive surgery at University of Chicago, Illinois. And now I'm here.
Well,
Baptist.
well, that's a long path
Yeah, it
to,
is.
to get here, and I'm sure that Baptist spoke to you when you were in Chicago during the winter, and they said, "Hey, it's kind of nice down here." And you remember?
Yeah.
So you just touched on something that I did want to go into. When we say urology, people, especially men of a certain age, we think we know what urology covers. Very basically, what does urology cover? Bladder, kidneys, prostate.
So urology is the surgical specialty that is related with the genitourinary tract. Okay, so it includes the adrenal glands, the kidney, the uterus, the bladder, the prostate in the case of the males, and the urethra and the penis or testicles. So it's a very broad specialty with like it's we can treat things like from urinary tract infections up to cancers, right?
Mm-hmm.
And even traumas, right? So it's like kidney stone, for example. We do like all the tumors related with the kidney, the uterus, the bladder, the prostate, the penis, testicles, and we can also do some putting penile prosthesis for patient who has erectile dysfunction or any sort of
Oh,
trauma.
that falls under urology as
That's
well.
for under
Ah, okay.
urology, and that falls under the category, the subspecialty that I did. Also, I do like some certain like very interesting cases about trauma patients who have some issues losing any tissues that we use like other tissues in order to build genitourinary tract back again.
I had asked you earlier, is there such thing as pediatric urology or is it all urology?
So there is a when we do in the residency, we train in both. However, in order to practice as a pediatric urology, you have to do another specialty, which is 2 years. But my subspecialty is very close related because most of the surgeries that they do in pediatric surgeries, they're patients who was born with some malformations within the genitals. So I'm basically doing kind of the same techniques, but for adults who have some conditions or this like patient who didn't get care when they were the kids, and they're you see it as an adult, so transitioning to the as an adult. Something that I do
Okay.
as well too.
Surgery heavy. I did not realize.
Yeah, very heavy.
So why is it important for a community to have access to a urologist, urology practice?
So it's let's say it's very important because one of the things that we do is actually like, for example, the diagnosis of cancer. All right, and one of them is prostate cancer, which one of the most commons that men has. All right,
Mm-hmm.
so not getting proper care, not getting the proper information can lead you to a devastated like disease. All right. And the same thing, for example, kidney stones. Sometimes can start with the small kidney stone that can fill the whole kidney, and you can lose it. And you can lose it. You can lose the whole kidney because of that, getting like a big infection and ended up like in dialysis. So,
Gotcha.
same thing would happen with urinary tract infections. Sometimes it's just a simple urinary tract infection that can clear with antibiotic, but sometimes you have a recurrent urinary tract infection that is just because you have an anatomic problem that can be fixable with surgery. So it's like very important in general, to be honest.
You did touch on something that when you were doing your studies, you spent barely 2 weeks in the urology practice. Are there a lot of graduates in this specialty, or is there a
So not much. Like for the American Urological Association, basically they said they quote that around 400 graduates per year for 300 millions.
people? Right.
Yeah.
Sure. Uh-huh.
So it's very minimal. There's a need of urology all over the country. Okay. This is why, for example, when I was like on talk about the job in South-Dade, I find out there was no urologist over there. So it was a community that has the need for one, and I said, okay, this is
Okay.
something that is online.
Put a pin on that. We're going to get back to that.
Okay.
But you're speaking about a need for doctors. One of Baptist's partners is FIU's School of Medicine, and that was one of the reasons it was established. It was to meet this deficit of doctors, especially in certain communities. So we'll circle back to that. So then, how did you come to Baptist, and specifically within the Baptist system down to South-Dade? How did that conversation happen?
So I was looking for a place who can be like a big like in let's say a big industry within the healthcare system.
Sure.
And Baptist is one of those who has like a lot of technology, a lot of resources and everything. So then I was like, I have friends who graduate in urology and they start working with Baptist, and I start talking to them, and they were telling me how amazing it is the um, the system within the physicians with the employees and everything. I had the opportunity to work in some other places when they were not as nice with the employers, and it's something that I didn't like that much. So that's something that like actually I was looking into the place I was looking. Like I was looking where people were happy. So pretty much the employers were happy, the employees were happy.
It's funny, we don't think of Baptist Hospital as an employer where the folks working there are employees. And I know it is, but you're putting a light into it that I hadn't really. It's important for the docs to be happy. It's important for the nurses and the other frontline staff to be happy. Yeah.
Like if you're not happy in general, you cannot provide a good care for anybody. Just imagine just coming to your work every day and you don't have the resources. You don't have the opportunity to like basically help the persons or the patients that are right in there, and that's not providing good care. So that was something that was like drive my motivation to go to a place looking not only like let's say the doctors or the head of, but also other employees. You know, everybody. If everybody were happy, it was a good environment to work.
Okay.
So that's
So
where
then-
I put my
So
logic
then,
on.
within the system, which, by the way, many of us have good friends that work within Baptist. Within that system, then, how did you find your way to South-Dade? How did they convince you to come to Homestead?
So I was looking into the map and see where were the communities who were in need of somebody. Okay, so I I like to do a lot of the social like work within medicine. It's based on my background and the way I am. So looking into that, there was a need of in South-Dade and
I'm sorry, need because of lack of
lack of urology.
urologists.
Yeah,
Okay.
lack of urology. So the care of those patients were very limited. Most of them they had to drive in order to find somebody who can help with something simple or something complicated. Okay,
Hmm.
and then like looking into like part of the like social component of everything. This is like a place I feel like I can fulfills the needs that were then. So it was something that drew my attention. And later on, when I started like looking into the places, I honestly had to say, I never expect how big or beautiful hospital I was like going into it.
It's nice.
So
It's a nice place.
yeah, and then looking into the facility, looking into the resources, looking in the disponibility and how the team is like were willing to help me in order to develop a practice. I said this is the right spot. This is the place that I want to get.
Well, I don't want to feed into your ego, but they're very, very excited that you're there. Carl Seta called me right away and said, "Hey, we need to meet this gentleman because he's lights out." Miss Marissa Suarez is helping bring you into the fold and introducing you to the community, and something that I wasn't expecting, because again, healthcare is a need, healthcare is a right, right? But it's also business. And one of the things that she had you doing is to go into the Homestead Hospital service area and introduce yourself to the primary care physicians. Why that exercise, and how was the reception been?
So in terms of the reception, it was like amazing. I
Yeah.
didn't expect somebody happier to see me. For real, it's like the only thing. It's very common this phrase, like, "You're the new urologist." Oh, we were looking for one for years, and I was like, "Okay, that's
Yeah,
great.
that's me.
That's me." So
Thanks for
that
waiting.
yeah, that's part is actually like great. And one of the things is like um, basically the patients that will need to come to the office sometimes they need to have the insurance, right? And that will bring some that usually brings some revenues to the hospital that can use in the charity
Sure.
care.
Yeah.
So that's very important for the whole system. So that's one of the things on the mission that Baptist has, and that's one of the things that I focus on too, because that was very important not only to like get some reimbursement out of like something, but also trying to help like the population that is in need in
Sure.
general.
Sure. Sure.
So that mission, that's something that actually draw my passion as well. And I said, well, this is a place. And I found the same thing with the doctors down in the let's say in the Homestead area. They're very receptive, very friendly, super nice. And even the population of patients that are going into the clinic, they're extremely receptive. Like when you are telling you something that they need to do, they do, they follow your instructions. They're very concerned about their health and they listen to you. And so it's a good response, nice rapport. I'm super happy to start.
We're fortunate to have a number of um, doctors practices in the chamber, and I can only imagine that if I'm a primary care physician, and up until the other day I had to refer my patients to a specialist in Kendall, in downtown, in Doral, or whatever, there's always that slim chance that I could lose them.
Mhm.
They might find somebody else. So having you, it's more convenient for the patient, and on the business plan of the primary care physician, it helps them to hold that relationship.
Also, there's something that you never thought about it until you leave it. It's like basically, it's like, oh, I can just drive 30 minutes from here and basically have care and come back to my house. But when you're in the hospital, you feel very lonely, to be honest. So you want to have your very close together. So let's say your friends, your family, and everything. And when most of the patients, when they have to come to the hospital, they need somebody who can bring them or whatever. So it's very nice and let's say cozy and friendly to have a like local hospital who can like help you with that part as well, like have everything close to you within your community. So that's actually something that the primary care were like thinking and care about it, because sometimes sending the patients over to some other places far from them It's not only losing them, but it's also like they understand how complex the level of care will be for a patient and how much logistic they have to do in like for the patient. And sometimes the patient just say, you know what, I'm not gonna do anything.
Now I'm embarrassed. I'm thinking business, business, business. And you're saying, yeah, there's a humane side to it as
Yeah.
well. So I'm sorry about that. You mentioned also about the pair mix. Now, from the real estate side, I can tell you that South-Dade is changing leaps and bounds from what it was 15, 20 years ago. There's a new influx of residents. There's a new influx of businesses, and every day things are changing. That pair mix, as you mentioned, that helps in the whole equation, right? The charitable work that the hospital can now do is supported by the other type of patient, the paying patient. So that does help you. That was a good point. Um, as far as you know, then, in speaking South-Dade, what other specialties are we deficient in? What
That's
are
a
your
good question. Some of the things I've seen related to my specialties that I would like to have is like, for example, interventional radiologists. That's something that we don't have in the system in the South. However, it's always most of the procedures that interventional radiologists do, they're like can be outpatients, so they can go within the same system, but just go to the South Campus and then come back and have that done here.
Mhm.
Other than that, like in terms of the hospital has everything that we basically need. We got a pulmonologist, we got intensive care units, we got gastroenterologists, colorectal surgeons, new surgeons who also like perform robotic surgery as me, and like super nice young team of physicians working like in Homestead. It's, so far, it's good.
Marissa, when she was introducing me to your bio, to your CV, she mentioned the phrase robotically inclined many times over, and we talked about that a little bit. What does that mean? And you clarified it now by saying that what your specialty is, you're a surgeon. What has Homestead Hospital? What resources does it have that helps the patient regarding robot?
Yeah. So within urology is one of the few specialty where the platform that robotic surgery came out of like to the healthcare system was one of the first one to adopt. That was in the like early 2000s, right? And when I say robotic surgery, I usually tell the patient, don't imagine I put a machine inside of you and they will do the work for you.
Okay.
Basically, it's a laparoscopical surgery who we attach robotic arms to the laparoscopical port, so we can control those arms through a console. And the beauty of it is a minimal invasive surgery. So recovery wise, patients for same surgery in the past they used to spend in the hospital 5 to 7 days. Now it's like sometimes they are outpatient surgery, sometimes they are like next day like discharged to the home. And in terms of like the beauty of the work with the robotic surgery is like you need a small field of surgery in order to do the whole case. So in the past, for example, prostatectomies, you had to do a big incision in order to take out the prostate. Now with the telescope cameras and everything, there's minimal, like 8 millimeters incision, 5 of them, but you can reach places that we never imagined that you can able be reaching with the open traditional surgeries. So you and is a is since I said it's a telescope camera who has some zoom, you can see nerves, and so
Wow.
you can go directly to the structure that you need to repair or take or remove in order to perform the surgery. So it's like quite amazing.
Wow. Homestead Hospital then it has the specialties and it has those types of resources.
Exactly.
You don't know. No hay que envidiarle a nadie.
No, not
Okay.
at all. No, we got it all.
We got it all. You, I understand you have also additional interests that, aside from the studying that you did, the training that you did, the the work that you're now pursuing, you also have a charitable side to yourself. Could you give me some details on what you do on your spare time? Spare time?
So, yeah, that's a good quote phrases. So, I've come from a family who several of my my relatives are like teachers and like university professors, right? So that's something that I was always have in my background.
Hmm.
And one of the things that I like to do is basically teach. Actually, I was a professor back in my university in Venezuela, and I try to maintain the relationship with them and create some like mission trips to South America. We were able to do some of them in order to like teach to other doctors, okay, other urologists, some of the technique that I have learned here in United States to bring it back to the communities as uh, places in South America that they don't know how to do it or perform it. And so that's mainly within the reconstruction. And the good part about it, like most of those patients that I was seeing over there, there are patients that they cannot like access to the specific care that I was doing because not even in North America, nor even here, there's no more many urologists who can do reconstructions. Okay,
Oh,
so yeah. So I was one of the few. So I was trying to, and I'm still doing it, to try to bring the same techniques I have able to learn here from the best doctors, the best surgeons, to bring it down to South America. So that's a like good part. Always teaching somebody so you can replicate the techniques and more access and more good care with health for those patients, right? So it's great.
when you say South America, what any specific countries that you?
So I've been in Colombia, Honduras, Guatemala. There's one trying. I'm trying to see if I can go back to Venezuela and do it over there. Let's see if he's able to it.
Hmm.
There's always some politics that difficulties, let's say,
Yeah.
but we had to work on it. I promise.
Your family, you have family still in
Yeah,
Venezuela?
my parents still there. They're fine.
Good. Okay, good. Um, so when you, in your transition to South-Dade, tell me some of the things, because when you were here before, you were in Miami Beach, Mount Sinai, you were in Jackson. What have you discovered about South-Dade that surprised you, perhaps?
One of the things they have an amazing gastronomy. Okay.
Yeah, we
Yeah,
do.
I had to say there's a good like let's say good Mexican restaurants down there, very traditional. Another one that you can find here, like
Right.
on let's say on in Dade or other areas close in Miami Beach were more non-traditional as well. So that's one of the good things. Another is like people they're very friendly over there, so they want to go there and like chat with you and like know you better.
Right.
So it's a good community to be honest. And you have other sports like the racetrack is there if you want to go and see the NASCAR last couple of
Yeah,
weekends.
yeah, yeah.
So it's a good community in
Oh,
general.
we're,
And
we're,
you have
we're
the
really
keys
happy.
down in the south. So the other day I was able to like do my first fishing trip, and it was something that I enjoy. So it's like exploring the community has been so far good. I like it.
Gonna use you for my real estate practice and say, you see, we do have it all. So one last thing I want to ask you about Baptist Hospital is your practice. Is this a practice of one? Are you going to? Is there room for expansion?
There's a room for expansion,
Uh-huh.
yes. So far as the practice of one, but the plan is to try to expand the practice in order to have the access from like South Miami to Homestead area, like at least another 2 or 3 more urologists in this area in order to have everything that it needs. And one of the things like we are trying to create is to have within this the urology their subspecialty, right? Try to have like one of each of us being the
Mm,
different specialists so we can have the good and proper care and everybody can to dedicate what is the most passionate part about it. So
right.
so far that's one of the beauties that I found was a challenge to create something because when you retire in the future, I'm talking about I don't know how many years, but I hope my career will be long.
Uh-huh.
You turn around and say, "Well, I was able to create something that is serving the community." So.
I think that is that's the one of the biggest points you just made. I was reflecting on how the hospital has grown from nothing there. Baptist made this big investment, almost too big, people would have said back then. I mean, now it's just the right size. They have to expand it.
Yeah.
They've had the foresight to not only engage with community, but to look for specialists such as yourself and reaching far out to get you. Your CV must have been impressive. What is it about your background, your training, that Baptist found compelling, that they said this is the guy that we need? Because I don't want to embarrass you, but they were after you for about a year. They were they were pursuing you for about a year,
Yeah.
which is complimentary. This says a lot about you.
One of the things I have to say, besides the background of the where I was born, I'm able to
Mhm.
speak like certain language, and I was able to reach the community in a different way. Um, just like, let's say, being a urologist is like of something quite of, because only 400 graduates a year,
Mhm.
but actually also try being a reconstructive who also can do minimal invasive. That's something I'm able to like compile everything within urology. Okay, so
Mhm.
in the same way I can do one day um, cancer survivor patient, I can do a cancer patient. So it's, and a stone patient, for example. So it's the beauty of what I try to make in my CV in order to trying to fulfill some a lot of grounds within the urology. So that was probably, I was a right pair person. And you
Gotcha.
were mentioning about how the hospital big it is.
Mhm.
It's actually, I think they need to get more. Yeah, there's a
Well, they 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 have a track record. Baptist does, of growing and being in the right place at the right time. So I think you're gonna see that need supported. And
I like it.
well, it has really been a pleasure to meet you, Dr. Cedeno.
Likewise.
I'm very happy that Carl recommended that we introduce you. I am really impressed, and I'm super happy that South-Dade now has, with your presence there, just another component that the healthcare um, the healthcare service and industry in South-Dade is being covered with expertise such as yours and such a great partner as Baptist Hospital. So thank you very much for your time. Thanks for being here, and thank you. Where am I looking at? Thank you guys for visiting us once more with South-Dade Shout Out. Please stay involved. Please reach out to the South-Dade Chamber if we could ever be of assistance to help you grow your business. Remember, South-Dade is a wonderful place to live, grow, play, and thrive.